Okay, so I'm back. So I think it's a very interesting time to talk about the role of technology, making healthcare affordable and accessible for all, given that only a couple of years ago, all of us saw a pandemic which changed the way we saw lives. And it also made us realize the importance of technology in healthcare and beyond that. So I want to open this conversation with that, keeping that point in mind, and want to know all of your opinion. How much in these 2 years have we really evolved and taken the value-based healthcare system? You can start.
So I'm a pediatrician, and during COVID, we all were sitting in our chambers, and we could actually guide many parents from remote areas also about how to take care of their children who had COVID. Actually, COVID wasn't very serious in children, but we could guide them, and all that we needed was this technology. So over a video call, we could guide them, we could ensure that they didn't abuse antibiotics or steroids, and they reached their children at the right time and they developed MISC. So yeah, technology helped us a lot during those times. And now we are able to incorporate the same thing in our practice now. Even now we continue to practice telemedicine, do video consults, and this made life easier for the parents and more affordable, and we are more accessible to the parents.
Rooma, when you were, I'm sure, able to address a lot of these things through mobile phone, as ma'am just pointed out, but with India, I mean, large part of India still not being that tech savvy, what sort of challenges would you run into, and how would you solve it?
I think it's wrong to say that India is not tech savvy. You'll find a smartphone in everybody's pocket today, and I think we should leverage that technology. As a gynecologist, in the last few years that we had COVID, we actually made a difference in two aspects. One, as gynecologists, we deal with pregnant women. And pregnant women, it became very difficult for them to come each time into the hospital. And just like Sivaranjani said, we leveraged the technology to be able to do the teleconsulting, telemedications. And so their visits to the hospital reduced, and we, of course, took care of them. However, being a minimal access surgeon and robotic surgeon in the gynecology field, we made a difference for women suffering from gynecological problems by using this technology to do surgeries for women so that their contact to the hospital reduced. We reduced their length of stay in the hospital. They could come in the morning, literally go in the evening or the next day. So and they would get better, so we don't need to keep them for days to get in the hospital and reduce there. So, because the main COVID was a problem of people-to-people contact, and that's how we could leverage the technologies to be able to make a difference for women's health at that point of time.
And Dr. Arvind, you have a large footprint across India. You have in the diagnostic space. So how different were the times for you, and how did technology help in that regard?
Our profession is absolutely based on technology. And the part of physically taking the blood, of course, that is different. But after that, it is all technology based. We can register the patient in his own home into our computers, etc., see what the tests are, and tell the patient through technology again when the result would be ready. And once the samples arrive in the main lab, it is all technology driven. I mean, the kind of automation which we have is absolutely, I mean, you will not believe it. It's like an automated kind of a factory. You know, hundreds of analyzers, there are tracks which are going, there are barcodes which are reading each sample, the tubes are moving in, and the automated computer-controlled analyzers are, taking the blood samples from one tube, putting it somewhere else, and mixing it with the reagent, and in real time, some report is being generated somewhere, which the doctors are, validating and the report can be downloaded with the, on the patient's, as ma'am said, on his own cell phone or on his own computer. So we are completely technology driven. In fact, we were the first people in India to use computers way back in 1986. So since that time, it's known as the Lab Information Management System, or LIMS, and we are children of technology.
But sir, as we keep integrating more and more artificial intelligence, more automated processes, what I want to understand, something that we discussed in the previous session also, that it requires complete reorientation or evolving of roles time to time in every few years. So how do we go about that? And I would like your input on that as well, like, because the healthcare workers are still the same. So how do you teach them? How do you help them, be reskilled and be up to date with these technologies?
So, again, artificial intelligence, as you heard today, and machine, learning. So we introduced artificial intelligence-based 2 tests more than 3 or 4 years ago. One is AI-based breast cancer diagnosis, and the other one is AI-based prostate cancer diagnosis. Both these cancers are very important. The breast cancer is the #1 cancer for women in India, and prostate cancer is #2 or #3 cancer for men in India. So the diagnosis of that is completely based on AI. And of course, the whole histopathology departments, including histopathology, I should say, they're all digitized. Now the pathologist is sitting, say, in Surat, and the slide is being seen in Delhi, and she can report on that slide. So that also, it's not being done by artificial intelligence now, but very soon it will be done. So that's the way we look at technology.
Ma'am, you want to add anything to that? In terms of reskilling, how do we go about it?
I would like to add a little bit regarding skilling. So I'm not a doctor, I'm not a medical doctor. I've been in the education field, and I feel there are certain skills that are very important if you want to leverage artificial intelligence for the students, for the faculty. So again, my perspective will be more of higher education. There is a skill called prompt engineering, which is how do you elicit the right response from AI? How do you leverage AI to get, answers? So a couple of years back, when we were using artificial intelligence, there was a lot of difficulty in terms of getting the right answer to the question that we are asking. So what is prompt engineering? It is about how do you prompt AI to give you information. Now, what do you need for that? That is a skill, You need to ask the right questions. You need to have that analytical mind to be able to, divide the question into parts and prompt the artificial intelligence, the AI tool, to give you the right answers. So I think we were talking about skilling, so I was just waiting for my chance to talk on that. And when we say that our, this 21st century young learners need to be ready for embracing AI, we need to train our faculty members also. I find that the biggest challenge, because so many of our faculty members are from another time, including myself, and AI is new to us. So until and unless faculty members are train the trainers, it's very difficult for the, young generation to adapt to
So what is more challenging, educating the students or training the faculty members with these technologies?
What is more important to us?
What is more challenging?
More challenging is training the trainers, training the faculty. Young people always tend to learn fast, right? Their mind is more, you have to unlearn certain things. And I'm telling for myself also, you have to first unlearn and then relearn. While when it is the young minds, they are fresh, it's like a fresh, fertile soil where you can plant a seed and a beautiful tree grows. So,
I think the point you raised is very valid. With all these new technologies like artificial intelligence, that large learning model, deep learning, there is of course the learning that we and our the generation that's building up should learn, but we also should understand that in all these large learning models, the ultimate output will be what we put as an input. So correct data has to be entered. Otherwise, the algorithms that will get created will give us the wrong answers. So today we are thinking and looking at our
medical graduates 10 years down the line to actually put in the symptoms, put in the problems, and they'll get an answer. But they will only get the correct answer if today we have put the right information. So that is so very important, and I think that should be done with earnest
Absolutely.
and real value. So
Absolutely.
that makes a difference.
So when we talk about data, because it is the core of training any large language model, any AI model, how do you go about cybersecurity? How do we ensure that we, and whoever is using these models, they maintain certain ethical practices to train these and the data is still saved?
So see, first I'll quickly come to the COVID aspect of it. See, we are a highly tech-driven company, and when we ventured into the healthcare space before COVID, when we were starting our research, we were not as conscious of cybersecurity. But what happened was that with COVID happening, we started facing about 3,000 plus attacks on a monthly basis on our servers, which is when we were prompted to actually look more into it. Today, actually, as a company, we have learned over time that the data privacy is a big challenge for us. Again, as far as the challenge on the Indian front is concerned, yeah, people are tech savvy in India, but the problem is that people have smartphones, but the internet is a problem. All of them don't have the data packs that they need. So we being a tech company, our biggest roadblock for success is that if they don't have a data plan, they can't use our apps for analytics and do things. Second problem is again hacking. Tremendous amount of attacks which happen on the platform, so we have to move to digital twinning. We are engaging a lot of hackers to help us making our platforms more secure. Data privacy, once the law comes into effect, then everybody is going to be having a hell lot of time, because
there's also this question of where the data is being stored.
Sorry?
Right? There's also this question of where the data is being stored.
Correct.
Eventually, yeah.
So the point is that data obviously it travels through multiple sources, and data centers again your app, there are so many insecure areas where it can be compromised. And we are just concerned right now that once the Data Privacy Act kicks in, like you're aware that now there's a law which says that if you're compromised, you need to report to certain 6 hours time. 6 hours, that I don't know how to deal with it, but that's what we are living in. So these laws are going to definitely be a big challenge for a lot of healthcare companies now, and it's for the best only.
I'm sure.
But cybersecurity is a key aspect of success now.
Yeah, I'm sure. Also, this is, I think this is a very large conversation to be had. I'm sure we'll keep having it in the years to come as AI keeps evolving and we keep integrating that more and more in our workflows, in our daily routine, in healthcare as well. Thank you so much for your time. That was my time. That was my questions. Thank you for your wonderful insights. Let's carry on with the show.
Thank you.